Welcome, ladies and gentlemen. This is June Archer, your host. Tonight, we are talking about some really fun stuff. Men's health on the inside and the outside. I have some special guests today. Some of them you may know, some of them you may not. This is going to be a lot of fun. And please, I encourage you all to ask questions, chime in. There are no dumb questions. We're here to have fun. We're here to be educated. And I'm going to give you guys a second or two. Cheers to all of you. I want to say to all of our healthcare workers who've been on the front lines, our practitioners, cheers to you for keeping us safe during the pandemic. So let your hair down tonight. We're going to have some information. We're going to have some libations, and we're going to have some fun. So let's get started by introducing some of my amazing guests for the evening. This young lady I have known for 22 years, going on 23. Amazing. She is a physician assistant, surgical PA, in so many regards, just an amazing woman. Please welcome to the stream, Mrs. Alex Archer. How you doing this evening, Mrs. Archer?
Hello, everybody. I'm doing well. I'm excited about tonight. This is the first time you and I are kind of hosting something like this together, so I'm excited.
I'm excited. This is awesome. Welcome to the show. Welcome to my world.
Thank you.
This is awesome. Cheers to you, my love. Cheers to you.
Welcome.
Our next guest. I don't know what else I could say about this young lady. She's amazing. She is hilariously funny, and what she is she's very serious about urology and what she does in that field. She is a PA as well. Went to school with my wife, and this really is her encouragement to share her information along with her partner, business partner, about what it means to be beautiful on the inside and out for men. So please welcome to the show my wife's amazing friend, good friend, my arch nemesis, but she's also my salsa partner, Cindy Gavilanes. Please welcome Cindy. What's going on?
Hi, how are you?
Oh, so good to have you.
Very
I'm excited
excited.
to see the two of you together. This is amazing.
This is awesome.
This is fun.
Very excited for tonight.
Yeah,
Awesome.
definitely.
My next guest just had the opportunity to meet him backstage doing some amazing things in men. He is going to dispel so many myths, so many rumors. He is going to help us get in the space of being comfortable with taking care of ourselves. So I'm excited to hear all of what he has to share, all of his knowledge. I'm going to soak it up. Just turned 50. I feel sexy. Some days I don't look as sexy as I want to look, but we're going to see what this gentleman can help us do. Please welcome Jacob Sanchez.
What's up? What's up?
What's going on?
It's a
Welcome
pleasure,
to the
man.
show,
Thank
brother.
you.
Welcome to the show.
Oh man, thank you for having me on, June. I really appreciate it, man. I've heard so many great things about you. It's an absolute blessing and an honor to be on your podcast, man.
Thank you so much. And just thank you for just making time. I know you just finished a podcast that you're doing, and I want to share that as well during this talk. But I want to start with kind of jumping in at the piece what I think men, we kind of overlook. This has been traditionally something that women do. They take care of themselves. They pamper themselves. They want to look good. And as they age, there's certain things that they do to enhance and beautify themselves. And we're in a space where men, Jacob, we're feeling the same things now. And some of us are uncomfortable getting in that space. So I want to talk about if you and Cindy can kind of share what it is that you do and why it's so important. I want to talk about the outside first.
Okay, well, the outside. I mean, sometimes, man, that's a big open-ended question there.
Let's get into it.
So a lot of people, when they look in the mirror, what they see of themselves can reflect of how they feel on the inside. And I think that we're living in a day and age where we're so blessed that we have so many things at our fingertips, at our disposal, so that we can look good. I mean, the average lifespan is continuing to increase, and I think within our lifespan, we're going to see people living. I think the average is going to be above 100. We'll see that. We'll see that, and I think it's going to be through the combination of people like Cindy, who have become experts at hormone replacement for men, but also peptides and just biohacking um, and so much more technology that's coming down. But people want to look good while they're doing it, and that's what we're on the forefront of doing that. And we're seeing the straight male demographic also, as well as no matter what gender, what preference you may have, people want to look good. And it's about living a positive, influential life while looking good while doing it. Because now, as you can see me, I'm on a podcast, but also on Instagram Live. Man, your legacy can live on. It's all about what you want to do with this legacy, what you want to do with your platform. And it may not be for thousands of people. It may just be for the few people in your life that you cherish and that you want to influence. Maybe for your kids, maybe for your grandchildren. You want to see, hey, my grandfather June, he's a man. He was raising the plateau. He was raising the roof as to what we can do with our lives. And he was looking good while doing it with his gold chunk, man, looking smooth.
You heard me? You see the kid? You see the kid?
I see it. Record labels in the background. Man, that's what it's all about. It's about.
So let me ask you this though, Jacob. What are some of the misconceptions? Because traditionally, men that would pamper themselves, other men would say, "Oh man, this guy's in the mirror all the time, and he's waxing his eyebrows, he's doing all these things." What has been the change of heart? What are the misconceptions that you could teach for those men who are on watching and listening tonight? What are the misconceptions?
I think that you don't have to be a metrosexual to care about how you look. I feel like some people may look at me and be like, "Oh, he's a pretty boy. He may want to." No, I don't give a shit about that. It's about what I want to leave behind. I want my daughter to see see her father not only change his life, but change the lives of other people around him. It's about how influential can you be, and looking good while doing it. Shoot, that just puts the icing on the cake.
Now, for you, how did you get into it? Like, what inspired you to want to take this up and kind of inspire men to actually follow suit?
Well, it was actually women that inspired me.
Okay.
I'm an anesthesia provider by trade. I'm a CRNA, board certified registered nurse anesthetist. So I went from the hospital, working in the private sector, delivering anesthesia for women who wanted to do the breast, nose, tummy tucks, mommy makeovers. They wanted to reinvent themselves. They wanted to reclaim themselves. And I saw that where the trend of medicine was going. People were looking for a more non-invasive way of managing the aging process. And whether it's through a valvular procedure in the hospital, they're finding ways to do it where you don't need to induce general anesthesia, or a rhinoplasty in the private sector where people don't want to go under anesthesia, and they want to be able to go back. If they want to change something and not have something permanent, they can do that. So when I decided to take that leap of faith and be like, you know what? I think there's something big in this. I saw people come into our office when we were running one room. Now we have a 13,000 square foot facility, but we wouldn't have gotten there if it weren't for these young women and also women from every age demographic, gender as well, coming in, revealing their insecurities. And I found that, as a Latino man, we're usually taught that you got to hide your emotions. But these people were coming in, they're revealing their darkest insecurities. And I was like, damn, you got to have strength to do that. To come in and tell somebody, hey, I've been bullied all my life since the second grade about my nose, or about, a certain feature about myself. And to reveal it to somebody that you don't know is like, man, I see that person as being really strong. There's strength and vulnerability. And I think that men are starting to catch on that, hey, that actually makes me a better man. The fact that I can be strong, I can be a provider, but at the same time, I can be vulnerable, and I can show my strength through vulnerability to the person that I want to give myself to. And that's what we're seeing. And I was like, you know what? I want to adopt that. And I did. And within the first year, second year, I was like, man, I want to be that. And that's really what catapulted my career in aesthetics. It wasn't about the outside. It was about the inside. It's about getting in front of the camera and be like, hey, I'm human. There's a lot of times I don't want to get on front of the camera, and reveal my insecurities, but I know that I can change somebody's life while doing it.
I love that. I love that. Now, Cindy, I want to kind of follow that up with what it is that you and Jacob do. There's a process that you guys do. I'm not super familiar with it. I've heard it, but I know that it is something that really changes or enhances the beauty, right? And kind of gets rid of the aging or the stretch marks or the aging lines. Can you explain to our viewers and listeners what that's called and why you believe it's so important? And we have some images that we're going to show the audience in a little bit, and you'll have the opportunity to explain the process.
Well, I mean, I'm going to start by saying I met Jacob. I actually had followed him for a while, and I was very impressed with the stuff that I saw. I saw like people were so moved with changes of the outside, and I was like, wow, you know, I do a lot of changes in the inside. I do all the hormone stuff. Guys come in there, they're sad, they're depressed, they don't know why. And so, yeah, I'm changing the inside, but, you know, you want to do both. You want them to feel overall great. So I was like, you know, I started talking to Jacob, and we thought, hey, you know, we can kind of combine both. And I have seen a lot of changes. I saw a gentleman come in, and he had some, you know, felt like he felt older than what he, you know, actually felt like, which you see a lot. Guys come in, they're 40, 45. They don't want to feel 40, 45. They want to feel 20. They still feel 20. And so there's certain changes that you can make for them, not only hormonally, but on the outside. I mean, people are always afraid of a little Botox. It's really not such a huge thing. I've seen in Get Refreshed, as I joined them, how these small changes are very subtle, and it makes the person feel much better. We're not doing anything crazy, and people, you know, just you'll see their personality change once they see that difference. It's amazing. So
let's talk about that process. And I have some images here I want to share with the audience. And if you can, kind of just take us through what this is, Jacob and Cindy.
All right.
What are we looking at here?
All right. We're seeing a guy who is on the left. He's at the prime of his career. He is basically a health coach. If you look at the rest of the body of this guy's super ripped. And because he's so super ripped and he's so health conscious about making sure that he's conscious about what he eats and about how active he is, he wasted a lot of the fat pads in his face. Now his body looks amazing. It looks like a 20-year-old, but
right.
because he's really been so conscious about what he consumes, it's wasted the natural fat pads. The cheapest filler on the market is fat. It really, if you look at a baby, if you look at someone who's youthful, you're going to see that these fat pads are really closely together. But as we age, what happens is the fat pads, think of it like a meat patties. Think about, let's say you're going to have a barbecue for your family and friends, and you have a barbecue, you got 20, 40 people who are coming in. You want to put all those pink meat patties on the grill, right? And you want to put as many meat patties as possible so you can feed everyone. What happens to these meat patties as they start to heat up and cook up? They start to shrink, right? They go from imagine you fill it up to the point where they're touching each other. As they heat up, they start to pull away from each other. So what you're seeing on the left is that these fat pads with age, they're starting to pull away from each other. And you're seeing these divots and you're seeing these valleys and grooves. With filler, we're able to replenish that fat pad so that it creates a more youthful look. While he has his fat pads on the right now replenished, now it complements his body. It's this contrast of like, damn, this person just looks youthful. It's not about him just being involved in his health and working out every day. It's like, damn, this person just looks much younger. And that's what we did. We filled, not so we can make him look like he's 20, but make him look like the best version of himself at whatever age that they're at. Because This is 2022. You can have your cake and eat it too. And I think that's what Cindy was alluding to, is the fact that people want to look how they feel inside. And there's nothing wrong with that. Because
here's another example as well. What happened? What did you do here? Like, what is going on in this image?
All right, so this is facial balancing. Unfortunately, this image is a little bit cropped. So we lifted this person's nose. We also replenished the fat pad underneath the eye. The eyes are the first giveaway when it comes to aging. Why? Because the skin is so much thinner. So it really shows the first signs of aging. But we also define his jawline so that it looks more masculine. Now, all you're seeing is the side. And this is immediately post-injection. So it's a little bit more defined. You can almost see a demarcation of the jaw, which is going to go down and it's going to look very smooth. I, myself, I've done this procedure to myself. And you can see that it's about looking as if you hadn't done anything at all. And what I see with women, and I've never shared this before, what I see with women is that when they come and sit in my chair, it's like, okay, this is a person they've handled their insecurities. Maybe they're not the prettiest person in the room.
Mm-hmm.
And with the use of this gel carrier and neurotoxin, you can make them look gorgeous. And after I've done these procedures, I'm like, holy crap, this woman's hot. I don't see the before.
Right.
What I see, the innate man in me is like, oh, I would totally bone her.
So let me ask you this then. Is there, for men that are watching, listening right now, what is the proper way to approach this? Do they come in for a consultation? Do they come in consultation and get to work? Like, what is the process? Is there let's see how you react. Let's try this out. What is the process that men go through?
That honestly, the process is the most important part, June, because when they come in, again, if they can show their vulnerability, they're already beating like half the pack of the men, because they show that, hey, I can be myself even in the state that I'm at, and that just shows so much strength. Through the consultation, it's like, hey, listen, I'm starting to see the aging process kick in. I want to feel better about myself. I just want to manage the aging process. And what we're seeing a lot more couples come in. Not just the man coming in, but the couples coming in, and they're coming in from all around the United States, all 50 states, sometimes international, and they're making it part of their vacation. Hey, I want to feel sexy. They're coming into Miami Beach. I want to feel sexy with my significant other. This is what I'm seeing. So I hand them the mirror and I ask them 3 open-ended questions. What do you see when you look in the mirror? And it's an open-ended question. Why? Because guys, you got to be more sensitive about how you ask these questions. You don't want to ask, if they say, what's up, baby? You don't want to say, hey, that's my daughter running in the background. What's up? You don't want to ask, all right, tell me what you see. Oh, I see that my nose is starting to get bigger and starting to droop, which your nose is going to continue to grow for the rest of your life. So you want to do your nose? Yes. Why? Why is a universal word for anything that you've done wrong when you were 6 or 3 years old, when you dropped something off the counter, right? They were like, why did you do that? So you got to be careful about how you ask these questions. And then the next question is, well, I see your nose. Okay, you have a concern about your nose. What makes you say that? Oh, well, I see that it's getting big. What makes me say that is, well, I see that when I take selfies, my nose looks about 30% larger than what it was. Or I'm starting to see this sagging. And just trying to develop that rapport with that person allows you to really see what they're seeing, how they're perceiving themselves in the mirror. And from there, you come up with a collaborative effort. This is not about selling fillers. It's about selling confidence. And be like, okay, this is what I think that we can do. In 2022, I believe that we can do this with this filler, this with this. I'm gonna inject a filler that is gonna make you look great now, but also it's gonna stimulate collagen production so that I don't have to inject you as much next year I see you.
I got you. Okay. How often, if that is the duration, like how often should men follow up with something like this? Is it different for everyone?
It is. And I think anybody who tells you, oh, like, I think you should start at 40, I think you start at 30, they're trying to sell you on something. I think you
Okay.
should be worried about those people. And in South Korea, they're using neurotoxin in teenagers. Why? Because it's blocking the sebaceous glands. It's blocking the glands that secrete oils, so that they can prevent them from having this oily skins that they may suffer from acne from.
Sorry to cut you off. I just wanted to make a comment. You mentioned, like, I have noticed we have seen a lot of more couples come in, and I think it's great because sometimes the wife tends to say, women, we always tend to say more than the man does, and so it's nice when the couple comes in, because then the wife will say, well, this is his concern. He just never wants to talk about it. And this comes the same thing when we talk about sexual stuff. The women's always more open about it, where the guy's a little more hesitant. So I think in aesthetics, I think it's great when the couples come in, because it lets the man be a little more open. Like, he will slowly open up when it comes to the outside part.
That's what a relationship is all about. It's about sometimes that counterpart voicing for you and advocating for you, especially right now. Like, it's slowly starting to become destigmatized, that your wife or your girlfriend be like, hey, listen, he's had this concern. Doesn't really bother him. Maybe it does bother him, but it doesn't really bother him, but he's thinking about it. And then you get him in the chair and it's like, oh, okay, all right. Because sometimes they don't have enough strength to show vulnerability, but just showing up shows that, hey, there's some strength in that.
So now, I'm a few years older than my wife, and she looks vibrant. Alex, I'd like to ask you: are there questions that or things that you want to chime in? Because I know that sometimes when you have an older man, younger woman, vice versa, like, you're trying to keep up with your spouse, right? What are some of the things that maybe men should be concerned about, Alex?
Well, first of all, I mean, I think it's great that there are more men that are starting to do this or being more comfortable with doing this. And I actually was going to ask Jacob, in the time that you've been practicing, have you seen a growth in that segment, like in more men coming in and feeling more comfortable with that process?
Yeah, 1,000%.
Yeah.
1,000%. We're about to see in 2022, we're about to see all these fillers and neurotoxin and hormone replacement. It's about to be destigmatized. People they're about to see, because I've learned so much from Cindy in the short amount of span that she's been here, where I was like, shit, what do you, I'm on testosterone replacement right now. What are you saying? Like, I just took my labs and saying my test is normal. Oh yeah, but your test is normal for a person that's 37. Oh, so it's a sliding scale? As compared to people, my testosterone levels compared to people at 30. I don't want to feel 37. I want to feel 18.
Exactly.
I want to wake up with a boner every single morning.
Well, and we're gonna talk about that. Let me just take a drink, because I think we're going there. Let me take a drink.
We're working our way into that.
I'm coming in hot.
And I'm right next to you. So I want to talk about this because I got a lot of people
No pun intended.
DM me, message me, and we want to talk about the inside now, right? Especially as men get older, testosterone levels, and Cindy, I'm going to lean on you, Alex, on this. Testosterone levels get a little crazy, and we try to fight this thing called age, right? And it's way beyond, you wake up and your back hurts, or you wake up and you're like aching. We're not waking up. Well, for some, they're not waking up with bonus, Jacob. I'm sorry to tell you. Like, ladies and gentlemen, this is the part of the show where you can sip your drink, put the kids away. We're going to talk about the stuff that you want to talk about.
The real, the fake, and the filler in between.
There you go.
There you go. So, Cindy, a lot of women were asking me, hey, this is great. I want to ask some questions. So I want to dive into it. I want to talk about the inside and talk about what that means when you need more testosterone. I'm watching television the other night, and there are like so many shows. You're talking about erectile dysfunction. What does that mean? How do you prepare for that, or do you not know? Like, what are the symptoms? And then, someone asked me, well, if you ejaculate often, maybe you're less susceptible to prostate cancer. I want to talk about some of these things and what that means. Because I'm in my 50s. I don't have erectile dysfunction right now.
Thank you.
I am getting
for
older.
sharing.
When I do wake up, everything seems to be all right. But I notice what you put inside your body, seriously, right? So I want to talk about those things, and I have a couple questions of things that I want to talk about. Roman for ED. I want to talk about Nugenics, boosting your testosterone. So let's start there.
So first, let's start with testosterone starts to decrease actually at a pretty early age, which is shocking. It can start to lower anyway between 35 and sometimes even 30, and we'll start to see a decline, which sucks because you're still pretty much in your prime at 30, especially if you're very active.
Well, I think, Cynthia, I don't mean to cut you off, but I think what's most important about this is how the prime of a male is so much different than the prime of a female.
Mm-hmm.
Yeah, but here's the thing. I think God does no wrong, but however, I think he got the lines crossed here because
I'm telling you, man, he didn't do us a favor,
we
bro.
should be peaking together.
At 38, 40, man, they don't even care. They're just like, yo, you can slap me around, call me Susie, and you're like, shit, I gotta be ready for this.
It's not fair. It's not fair, right? It's not fair. It's a young man's game. And by the time you get to this age, we hear that women start to peak sexually after 40. Like,
yeah.
What can we do about these testosterone levels? And I want to talk about erectile dysfunction, pre-ejaculation, all these things. So let's dive in.
All right. So
I know Alex has some questions, some really good ones that she's talking about. I don't have the answers. You do, and we could discuss it. So
for sure, I mean, if you think you have low testosterone is not only erectile dysfunction. Erectile dysfunction, actually, there's a little piece of testosterone that plays a role in that. It's more vascular, psychological, but we'll talk about that after. Low testosterone, you worry about changes in how you focus, if you're tired, if you're sleepy during the day. Maybe you don't wake up with an erection in the morning anymore. That definitely can be a sign of low testosterone. Stamina, endurance. If you work out a lot, you're not lifting the same. Stop it. I see you, Jacob. So those are all signs. Go to your practitioner, get a full hormone panel first, a baseline to see what you're starting with. And Jacob was right. What I had mentioned to him was a lot of the labs, and people don't know this, practitioners don't know this, but what labs do is they used to actually put it on the lab what your testosterone should be at your age. And that's what they range you by, which sucks because if you're 40, you don't want a testosterone of 40, you want a testosterone of 20, because you still feel good, or 30. Now the labs don't even show that. They just automatically put the range in. So you don't have to, you can't even think about where you should be at, which sucks. But if a practitioner used to see the old labs, we know that, they what's called age adjusted, they adjust it. That sucks. So we kind of try to, my goal is I ask the patient always, what is your goal? What are you looking to achieve? Are you looking for muscle mass? Are you looking just to overall feel better? And that's how I know kind of where to gauge you and where to start you. Because I don't want to put a normal guy who's, not working out a lot, but he just wants to feel better at a level of 1,000 if he doesn't need to be at 1,000. You know what I mean? Goal is very important. Where you want to be.
So it seems as though there's this age old thing, right? Is it the size of the ship or is it the motion of the ocean? I'm getting it's something
both
more than that, right? So, babe, you have some questions. I know you have some really good ones. Please chime in.
Well, I mean, I think it's kind of interesting. I wanted to actually touch base with both of you to sort of start to think about how do these things affect you, as you're trying to figure out exactly. I'm sorry. Sorry. Give me 1 second. Can you hold on 1 second, June? I'm sorry.
Go for it.
All right. I'm going to just.
So I got a question here that I think that I want to answer while we have this break. RC is asking, should you go with natural home remedies rather than pills?
So testosterone, actually, the only pill out there is Jatenzo. It actually cannot be filled. It doesn't go through the liver. So you have to do it through either injection or pellets or gels. You could always try natural. It depends what the goal is, again, of the patient. If the man is looking to I really want to see real results now, most likely natural may not give you, because it's going to mean that you're going to have to diet. You're going to have to eliminate some of that fat, because fat cells decrease testosterone. You got to be working out. You want to add weights because you want your muscles to want to make, crave for testosterone, so your body makes more testosterone. So it is harder the natural way. Absolutely not option. And there's other options in between. Like, you don't always have to do testosterone. I've talked to Jacob about this before. Like, there's HCG, which is off the market, but they have brand name Pregnol, which tries to boost your own body to make it. There's clomiphene, which is also tries to make your body to make its own testosterone if you don't want to use testosterone itself.
Okay. And here's another one. While we're here, just we'll it kind of coincides with what you just said. Question is, I've been getting T-shots for 3 years now, not feeling anything different, but I'm very active. Is it different for everyone? Does it affect people? Obviously, it affects people differently based on what they're doing. But
I think that's why we brought Cindy on, to get refreshed. She's a specialist in this. But I think the first question is, what makes you say that? You gotta understand, what is it that they're trying to achieve, which was the first opening question that Cindy had asked. Like, what are you trying to achieve? What makes you say that? And what would you say after that, Cindy?
Well, if the patient's been on it for 3 years, there's a couple of things. Number one, I want to know where they're peaking. I want to know, how high the testosterone is. Okay, because it fluctuates when you're on different types of treatment. So I want to know what your highest level is. Number two is, some people, if they've been on it for that long, we say that they've been on cruise control. They've been on it for so long that they're like, oh yeah, I don't think it's doing anything. Not because it's not, because they've been on it for so long. So I say, hey, get off, take a break. And then they feel that plummet and they're like, oh, I need to be back on testosterone. Now I see the difference. And then sometimes it's not even testosterone. Sometimes there's other, what the problem that you're having is not because of testosterone. So then therefore, maybe you don't need to be on testosterone and you have to figure out the other route of the problem.
I love that.
Okay. The same person says they place the same question when it comes to ED.
ED is another animal. People always confuse testosterone with ED. ED is a vascular, you get erect, so the blood flow goes there. It could be a vascular condition, signs of pre-diabetic, hypertensive, blood pressure. Sometimes it's psychological. So sometimes, yes, sometimes testosterone may play a role, but not always.
Okay. Now, Alex, back to you, because you were headed in the right direction. Let's hear that question again.
Well, I just kind of wanted to get into, with that said, especially as you raise the point that it could be another problem. Do you guys find that there are other medical conditions that can contribute to some of these problems, or other medical conditions that you're concerned about when you're treating these problems?
So absolutely. I mean, excess alcohol can decrease testosterone. Overweight, obesity, diabetes. Patients that are diabetic can have low testosterone. Some autoimmune disorders. So there's a lot of other medical conditions definitely can play a role.
Jacob, do you find that also in your practice? Is there any concerns for autoimmune disorders or use of alcohol, things like that, as it pertains to the procedures that you do?
I mean, I think lifestyle does. I think that falls into lifestyle. People who have, really just went, balls to the wall and just living life and not taking care of themselves, find that, hey, you know what? There's a solution. I can actually work on the inside and the outside to recalibrate myself and rejuvenate myself and turn back the hands of time. We had a Brandon Novak, who was a gentleman who was in the Jackass. Remember that Jackass series?
Yeah.
So he came in, and this guy had done every drug underneath the sun. He was a heroin addict. He was selling himself for drugs. He didn't take care of himself. And he found that, as I want to reinvent myself, I can use this to really turn back the hands of time. And when you just do what you do, but I didn't realize what we did for him when we saw him on other podcasts with other members of Jackass. And we're like, damn, did we do that?
Wow.
This is why this guy's flying in from LA. So people are seeing that, like, okay, I can have another lease on life. It's almost like when you turn in your car, how they vacuum it and steam clean it, and they put it right back to new.
Yeah.
We can do that. And it's so crazy. It's such a beautiful, we live in the best time ever. 10, 15 years ago, if you had ED, there was really much that we can do for you.
Hang it up, like literally and figuratively.
It's like, you're just hoping that it doesn't come to light. You're just trying to not even trying to bring it up to your spouse. You're trying to like brush
now
it
we have so many options.
And I want to talk about those options.
He has so many options. That's why, like,
but let's talk about them, right? Because I want people to understand. Some men, we are oblivious sometimes, right? What does testosterone mean for our sex drive, though? Like, you hear testosterone, you hear all these things, and some supplements and tiger bone and all these things were natural things that were brought up. What does that? What does that mean? Like, what does that really mean for somebody that doesn't understand?
Eugenics. I am not a fan of Nugenics. The only reason why I'm not, I've had a couple of patients take them, and I've seen the hormones go all over the place. So I'm not a fan of Nugenics.
Meaning what, though? I mean, because we're seeing these commercials late at night. If you're up,
we're seeing Bo Jackson.
You see Bo Jackson.
Bo knows.
Bo knows.
Yeah. So what happens is that if it's a couple of testosterone if you're using testosterone and you're a young guy, and that fertile age, you're still planning on having children, testosterone can cause infertility, number one. So that's, if your goal is to have children, you want to be aware of what you're using. Oh, maybe I don't want to use testosterone. Maybe I want to use something else. What I saw with eugenics was a lot of young guys were using it, and it was turning their hormones all over the place, which can potentially cause infertility. And they're thinking it's over the counter, safe, wouldn't do anything, no problem. And that's what we were seeing. So then now we have to put this guy on reset, which sucks. That means I have to put him back on 0. Mm-hmm. And now they're going to feel like crap until their body starts to wake up and regenerate their own hormones. I was able to put some guys on some medications to help their own body push it, but it took a little while. And so I'm not a fan of Nugenics. I think that if you want to go the more natural approach, like I said, there's other options if you don't want to use testosterone.
All right. So let me ask this, because I have a good friend of mine who drives trucks, and his concern was in terms of lifestyle, like sitting down and driving that long. Does that affect your sex drive? Like, he feels like, yeah, I want to have sex. I don't want to have sex with my wife. Like, we haven't done it in a while. Like, when I do, like, I'm not really interested all the time. Like, does that affect like sitting down that long, even if you're in a workplace setting? Does that? And I'm just asking because
it's not the sitting down. For sure, it's not the sitting down. But I mean, if he's living a sedentary life, because he's driving, is he overweight? What else is going on? Like, is he sleeping? Does he have sleeping issues? Does he have another partner?
Well, I mean, these are all good questions. You're right. You're right.
I mean, I'm just trying to be honest. There's a lot of reasons. I always say medicine, like as practitioners, we're like priests. We hear the whole story.
Yeah.
Gotcha.
So there may be a few things, if he's overweight, for sure, that could contribute. If he's not sleeping well, because he's a truck driver, yeah, his sex drive is going to suck because he's not sleeping well. Sleeping deprivation can cause low T or can cause erectile dysfunction.
Now let's talk about pre-ejaculation, getting too excited. Is there anything that you could share with us that for those men who are having that problem, right? You're excited, you're getting ready to handle your business, and then less than 2 minutes in, you're like, I'm done. And she's like, what do you mean you're done? Like, what say you?
So we don't really understand completely why that happens, but there is treatment. So the number one treatment is sexual health counseling, which it sucks because most insurances don't cover it, and it's very costly. So the other options are there's medications. Antidepressants were really popular a few years ago, but the side effects are a little harsh, and it's not the antidepressant that actually works, it's a side effect of the antidepressant. The other thing is we use a pain medication off-label, and the side effect of that pain medication causes delayed ejaculation, and that helps.
Okay.
Is there such a thing as like a prolonged ejaculation, or sort of taking
delayed ejaculation?
Ejaculation? Okay.
Yeah, we actually had a podcast with Jacob. I don't know if you remember, with oxytocin.
What's delayed ejaculation? Let's educate those who are watching and listening. Delayed ejaculation is what? Like, I'm doing it now, but I'll give you the ejaculation on Thursday. What? Like,
no, that's that's when you increase the brand. You increase the strength of the brand. You're like, damn, girl, I can go on for days.
I'll I'll drink.
And the girl's like, I'm still done.
Exactly. Checking the
Now
time.
we're talking about we're talking about putting things into the body, right? So
Yeah.
for some men, you know, I had a coworker years ago tell me, man, if I drink, like you can forget about it. Like I'm done. Like I'm no use to anybody.
Oh, yeah.
And then you have some men that are like, oh, when I drink, like I can't stop. I can go for hours.
Mm-hmm.
Right? Is there a balance? Is there, you know, definitely alcohol affects people, you know, men differently.
Differently.
But what do you say when it's too much? Like,
Delayed ejaculation can happen because of a medical condition, diabetics, for example, because of a nerve issue. It could be trauma. It could be medications can cause delayed ejaculation. But some of the treatments that are out there is, again, sexual health counseling is one of them, finding the core of the reason why they have it. There is something off-label called oxytocin, which helps and heighten orgasm. And so we treat that with some patients. Actually, some females like it. So
That's
it helps
crazy,
both females
that's-
and males.
That's a female hormone.
Yeah.
That's
Yeah.
that's what we give when in anesthesia. When a woman delivers the baby C-section, we
Mhm.
will drop a hefty dose of oxytocin so that the uterus can contract.
Yeah.
But in men, we also have oxytocin too, which is almost like that love cuddle potion where like, okay, all right, come over here, baby. Let me bring you.
Jacob's tried it.
I have.
so
I feel like a Care Bear.
all right. All right. So I want to get back to the low testosterone. So some of the things that could help men from the low testosterone point is what, Cindy?
Natural things.
Natural things.
If you work out, especially your quads, that's the largest muscle that we have in our body. So if you do a lot of legs, supposedly your body's going to want to make more testosterone. There's over-the-counter DHEA, which is a natural supplement. It is, I always say it's like the flour of like when you're baking. So it is the main ingredient to make testosterone. So if you take DHEA, it potentially will help your body if you're, doing all the other things. Dietary changes, you want to make sure you eat more greens, more vegetables. Greens help for increasing testosterone. Make sure you're sleeping properly, lower your alcohol, weight loss, stuff like that.
I want to ask, I mean, it's kind of off topic, but when you talk about putting that stuff in your body, other questions that came in is like ejaculation, semen, and what that means for women if you're talking about oral intercourse. Like, what are things that men can do? Women always talk about pineapples and eating pineapples. What can men do that'll make it more attractive for women, so that they be more interested and more willing to have oral sex, so that it's not disgusting, it's not salty, it doesn't taste like iodine, like all the things that you've heard. Like what can men do? Like what can we do? Like we always want it to be very enjoyable, but we want that same thing for our partner, our spouse. What can we do?
I've heard the same thing about pineapple.
Okay.
Jacob's over like, yeah, pineapple.
Jacob was like, so I'm good.
What's the answer to that?
Yeah. He's like Kanye West. I'm gonna let you finish.
I've heard eating healthy, is good. You don't want to smoke. I heard that smoking, can change that.
Okay.
So for sure, eating healthy and make sure you drink enough water.
Okay. We have a question here. Let's get to this question. So I take oxytocin, has to be given in office. Does it have to be given in offices? Somebody could get it over the counter?
No, it's prescribed. It's done usually by a compound pharmacist. We actually sell it either in a spray or like a troche. I just realized he's eating a pineapple.
He's eating pineapple. On cue, too. On cue.
I'm ready.
We don't have
We don't ask what he's going to do tonight.
Here.
We're not even going to ask what he's going to do tonight.
It's a snack.
I know.
I'm just getting my daily snack.
Okay. All right.
So I forgot.
Yeah. Let's switch gears here. So
oxytocin. It could be
Oxytocin,
spray or troche form. Actually, we even in the pharmacy that I use, we actually have it combined with Cialis or Viagra. Like if the patient has a combination of erectile dysfunction and delayed ejaculation, you can get it combined.
All right. So we had another comment here. One, my level is below 300. Not good. Last test, I was 290. Just wondering, because I work overnights for more than 18 years in a hospital, will that affect me that much?
So testosterone in general fluctuates. It's never like one steady number. It's always up and down all over the place. In the morning it peaks, at night it declines. And 290 to 300 is kind of like stable. It's really there's not a significant change. For sure, working night shift, there was a study done a few years ago that demonstrated that people work night shifts can have low testosterone.
Okay. Okay. I love it. I love it. I love it. This is all exciting for me because I feel as I'm getting older, I feel like the sex drive is there. But I don't know. As you get older, when that peak is no longer there, you know, I've learned a couple things tonight that give me hope that, you know, hopefully we could continue to trend in the right direction. You know, my wife doesn't have to upgrade me or swap me out, or you're not, you know, she's not looking for a trade. You know what I mean? Like I want to be able to keep up and but just feel good about myself. So some of the things that you talked about, Jacob, there was a question here that I want us to kind of get back to and throw it to you. Can you go overboard with fillers and toxins?
You can go overboard with anything.
Okay. Too much of anything.
Too much of anything. That's the. I mean, I think all four of us can safely say, even the viewers, that balance is the hardest thing to do in life. And you know, it's so pushing the envelope can be so tricky. But luckily for men, I feel like it's easier for us if we just accept it. It's easier for us to adapt to it more than our female counterpart, because we can look good. We can be considered distinguishing at 50 with the help of Cindy and Alex, and look good with, you know, Get Refresh, so that we have our imperfections, but we still perform like we're still in our 20s and 30s. And there's something beautiful about that.
Well, so let me ask you, Jacob, because you were talking about that thing that makes you cuddle. Now, the other piece is, do men, as we get a little older, do we need more foreplay? Does that help even out everything that's going on, so you don't have
I
to
don't know, man. That's
perform
like
so much?
that's a personal thing. I love foreplay. I feel like foreplay is really foreplay. I mean, honestly, you know, if we're gonna get down to the nitty gritty. Man, I think foreplay, I think sex in our 30s is something awesome, because we know what that person may want, we know what we want, and it's more about that mental connection. And then having Cindy and Alex come in for that physical connection that allows us to really just leave no stone unturned and just really captivate a woman. We know that it takes 0.2 seconds to determine whether or not this person is attractive, according to a study conducted at a UPenn. We look at a person on speed dating, and we're like, well, okay, this person, I would have sex with this person. Why? Because your body's and your mind is processing 100 things at once. The spatial distance between your eyes, where your eyebrows line up with your ears. But most people don't know this. And then, but that is the gateway of just, okay, all right, the next step is like that mental connection. And I think at 30 as a man, is like, man, I don't want to have sex, I don't want to make love just to like for that physicality. I want to connect with that person. I want to be able to just like share a moment with that person where I feel like, man, we just feel so connected, and I'm embracing everything that they've gone through in their life, and they're embracing everything that I've gone through in my life, but I'm giving it to them because I feel passionate about this woman. And having that capability through Cindy and Alex really allows us to get to that point.
No, I love that. I love that. Xavier says the perfect ratio. Yeah, I think all of us are just trying to find that perfect balance. We have another question I want to throw out to the panel. Can you speak to vitamin D impact on T?
So vitamin D does not impact testosterone, but vitamin D impacts energy. So if one of your goals is I have low energy and you're on testosterone, or you're not on testosterone, but your key goal is energy, then vitamin D is definitely something to add to that regimen of what you want to be on.
I like that. I like that. I like that a lot. Thank God. Fan says, thank you guys for it's very helpful. Last question. If your anterior and posterior tibial vein is broken, can that also be a cause for low T that leads to ED? That's a great question. Very intricate, but good question.
I don't
No,
understand the
I'm not sure, yeah, that
no,
there's
it
a
can't.
direct
there's no
correlation.
No,
connection.
because all right, we're talking about veins here. First of all, veins will bring blood back to your heart. We're talking about bringing blood down to the penis. Um, so I don't know,
The
Cindy.
only
You tell me if I'm
the,
wrong.
so yeah, no, there's no connection. The erectile dysfunction and blood flow, where we see it the most, is in diabetics. Why? Because they have neuropathy, so the nerves, right? Anything that's a nerve disease that can cause nerve damage, therefore it can have erectile dysfunction. If a patient had prostate cancer, they have prostate surgery, they're at high risk. And anybody who has high blood pressure, any vascular disease, so that means high blood pressure, diabetic. Why? Because the first place that you'll see those signs is in the penis. There's small veins, there's valves. The most common cause of erectile dysfunction is leaky valve syndrome, and we see that in patients that have, vascular problems.
And Cindy, for you, how important is it for men as we are getting those who are getting older, getting your prostate checked?
Oh, absolutely, 100%.
Prostate,
If you
prostate.
prostate, if you have family history, I would start at 40. Like for
Start
sure,
at
prostate
40.
exam, a PSA, the blood test to check for prostate cancer. I've seen younger guys with prostate cancer, and it's scary. The majority of the times, yes, prostate cancer is slow growing, but in the younger guys, if we find it, it can be pretty aggressive.
Okay. Jacob, this is for you. I'm going to bring this back. Please share facial tips for men that are susceptible to razor bumps, natural as well as procedures that you performed at your practice. Razor or electric shaving is challenging to many men of color. We had someone chime in about shave with Noxzema.
Yeah.
What say you?
So that is actually not a question for me, but rather your dermatologist. You can actually there's tips that you can utilize where that can prevent razor bumps, like using an antibiotic like clindamycin, where it'll prevent these ingrown hairs from becoming infected and getting these lumps and bumps.
Okay. Okay. I'm loving it. We have a few more minutes. There's a lot of things I want
Alex,
to.
you have another question?
Oh yeah, I do. It's like we're here, we're having a good time, we're talking about these things. I just wonder how the two of you would recommend that men sort of broach this subject with their loved one, with their spouse, or with other guys, because sometimes guys don't have these conversations amongst each other or with each other. They feel like they're the only one with an issue, or they're the only one thinking, man, I wouldn't mind if I did a little something here and fix this up. How would you recommend that men start to broach the subject in their circles, and then how they approach a clinician to actually, or get the courage to actually go out and seek, help for ED or self-care?
Can I lead this question?
Go for it.
Please do.
I think this is what we need to get back to as men, is being vulnerable, in that sense of like, hey, being vulnerable to the person that you love the most, and fighting for people that can't fight for themselves, or for the person that you love the most. And that starts with communication. It's so easy, but it's so overlooked. One of the biggest things that I've noticed in building an empire, with Get Refreshed, is that I don't do business with anybody that I can't communicate with. Same way that I haven't been able to find somebody that I can connect with, female wise, because I can't connect with. But just having that communication and being like, hey, I'm going to make myself vulnerable for you because I love you, allows the ability to find a solution.
Well, I'm sorry. Are you finished?
Yeah.
Oh,
Yeah.
I was just gonna say that I think that when it comes to like when it comes to low testosterone and ED type of conversations, you want to make sure that whoever you're dealing with, that you feel like they're with you. They're on the same page of what your goals are. That's very important. I see a lot of people that just go wherever, they treat them the same way. It's all cookie cutter, and it's not, because we don't all feel the same. We don't all have the same goals. And so you definitely want to find someone that you're able to open up with. As a female, I always feel that when I initially meet my patient, they're always like, like you're a female. But once I start talking to them and telling them, hey, I know how you feel. I'm not a guy, but listen, I've been doing this long enough. I know that this is how you feel, or this is what's going on. They start to say, oh, okay, because I know men always feel judged by everything, especially by a female, by the opposite sex. So don't always feel that way. You'll be surprised how much women, especially women that are clinicians, that I see this all the time, are very aware of what's going on and how you feel. And even if it comes to like aesthetics, I mean, we totally are understanding of what, what may throw you off, or what may not make you happy, or what you need a little bit of to make you complete or happy. So just feel comfortable talking, and you never know, I'll probably be on the same page.
I honestly feel like women are so much more open,
Yes,
than men. So like, if you can't communicate with women, dude, move on, bro. Move on. Find somebody that you can communicate with, because at the end of the day, no matter what we do at Get Refresh, looks are gonna go. It's about looking the best version of yourself at 50, 60, 70, 80. I mean, you're gonna look even at the best version of yourself at 80. If she's heavily weighing on what somebody can do at 20, she ain't for you, bro. You want to be able to have that communication, bro. Because honestly, at the end of the day, at 37, what I've realized, most of these people that are coming into our doors, it's about just what you feel inside. The outside is just a gift wrapping to the present, the soul that's inside.
I
100%.
appreciate that. That's
I love
dope.
that.
We have another question. I want to jump in. How should one go about seeking the proper doctor for these subjects, or practitioner?
You spoke to her.
You're a PA,
Right here.
right? So
You
how do
spoke to her.
how do people navigate that? Because that could be intimidating, right? Because Cindy, we'll joke around, right? I had to convince a friend the other day, man, go get your colonoscopy. Man, we have this pride and ego thing where sticking something in your backside is intimidating. It's something to demean you in. But if you could get your prostate checked, you could get like, why is it important? But how do you?
I think this is a good start. I think this is amazing what you're doing right here. Honestly, this is a good start, because people don't have to actually physically show their face or listening to what we're saying. So this is definitely a great way to start opening up those doors. Word of mouth is always great if you have a friend and your friend sees, but you have to start by having that conversation. And people and men are so, women, we always like, oh yeah, because this happened, but men don't do that. I was telling Alex earlier, we see guys that have blood in the semen and they're like freaking out. And I tell them, oh, it's actually a pretty common thing. It's usually benign. And why do guys not know this? Because guys don't talk about this. Yeah, they don't talk about this. So try your best to, if you're not able to talk to a friend or a guy, or, find a female, talk to a clinician, or come on these type of podcasts. You'll be surprised what you learn, and then you'll feel more comfortable that, oh, this is common. It's not uncommon. It's actually common. And so then you'll feel more comfortable talking to others.
I think
I apologize, honey, go ahead.
I was just going to say, I think sometimes too, I know that he wrote doctor in that question, but sometimes some of the practitioners that you may be most comfortable with may be a physician assistant or a nurse practitioner. And a lot of them they're well-versed in these things. Obviously, Cindy in urology has been doing this for a long time, and now in the aesthetics, as well as Jacob in this world. Like, you can find practitioners that are, you're able to kind of have a relationship with and feel comfortable with.
100%. I have patients that sometimes prefer to see me than the MD, because the MD is too busy. He's running around, doesn't have time to sit down and chat. And I'm sitting there, and what may seem like an hour for the patient, it's probably just 10 minutes, but it's 10 minutes of nice, pure, true conversation that the patient needed.
Exactly.
But I want to go back to something, Cindy, because I think that men, you made a point of blood in the semen. What does that mean for men? What should, when they go to a doctor, like how can they approach that situation? Because we are intimidated. We are
You can start a whole nother podcast, bro.
ego. I want to touch on it because
That's normal.
people are asking. I mean, people are chiming in, but there are no dumb questions, right? So
Yeah.
there's someone who just heard that, Cindy, and was like, man, that happened to me, but how do I tell my doctor that? Like, I just went and got my physical, but I never said anything.
So you
Like,
should always say something, because even though, yes, it happens, it's common, most of the time it's benign. If it's a recurrent issue, you probably should get a workup. If it happened once, most likely it's not a big deal. Make sure it's in the semen and not in the urine, because then obviously now those are two different things. Okay. But if it's in the semen, majority of the times what happens is like a vessel will get clogged, you ejaculate, which there's a spasm with ejaculation, and then blood may come out. And that's, again, a benign issue. It usually resolves within a few days or a few ejaculations. But if it does happen persistently, yeah, I would definitely talk to a clinician and say, hey, this happened to me. What's my next step? Again, most of the time it is benign. It's safe. It's not bad.
I think too, like you just said, June, there are no dumb questions. As practitioners, we see this stuff every day. We hear every version of the question that you're thinking in your head that you want to ask. We hear every version of it. We're expecting, like, we don't set a bar as to how patients can approach us. We love questions. We love to educate. We want to talk about these things. That's what we're here for. So I think people should have, try to develop the courage to go and ask those questions, anything that you're thinking, because that's what your healthcare practitioner is there for.
Okay. And I have some questions. So now I'm getting courageous. Like, this is for Cindy.
Personal?
I'm getting nervous.
No, not personal, but I'm intrigued by it. One, penile implants, is that a real thing? Also,
vaginal rejuvenation.
Say again?
Vaginal rejuvenation as well. We haven't talked about that.
Oh,
yes. That's a different show. We're talking about men's health, right? We're talking about men's health. We'll talk about that next month. We'll talk about it next month for Women's Month. We
can touch on it quickly.
Yeah. Well, yes. So at the Med Spa at Get Refreshed, we do offer penile enhancement and vaginal rejuvenation with fillers, which is pretty cool.
What does that mean? Penile implant. What does that mean?
So so penile implant is a different thing. Penile implants for erectile dysfunction, it's a device that we insert, but it is, because it's surgical, is last resort. So there is a process before you get to surgical, because there's other, issues with it. It is great, but again, last resort. But penile enhancement is like the increasing the girth or the size of the penis. Okay. And vaginal rejuvenation with fillers, we feel like, as with time, women can have vaginal atrophy, which can cause the outside labias to decrease in size. So we do add some fullness to it, which women, want. We also offer P shots, O shots, which is great because that helps for both erectile dysfunction and women and men with orgasms as well. And that's platelets. That's done with plasma, with your own blood. We reinsert that in those areas.
Wow. Okay. That's never knew. So now I have another one. Can you fracture your penis by having like really rough sex? And if so, what does a man do when that happens?
So it's not really a fracture.
Well, it's cartilage.
Yes, you can definitely hurt it really bad and cause trauma. Absolutely. Yeah. And you should definitely seek a medical attention if that were to happen. Because that can be serious.
Okay.
Yeah.
Okay. All right. Well, listen, any last words? I mean, this has been fun. The hour has gone by so fast. Jacob, I put your information in here. I want people to have the opportunity to follow you, what you're doing, ask more questions, engage with you on social media.
Oh, you know what I just noticed, June? It's Get Refreshed.
Get refreshed. So guess what? It's easy to fix that. Thank you, Cindy.
You're welcome.
Thank you, Cindy.
Make sure
anytime.
So we get the proper information to the folks.
For sure.
But it's Get Fresh.
Even if you want to come by and visit.
Come by. It's such a great vibe. It's so energetic. It's such an open, man, we get the sexiest people coming in. We get couples coming in. They talk about the wildest shit ever. They open up to Cindy all the time. It's crazy.
So not only do you can go golfing with your partner, you can play doubles and tennis with your partner, you can go out for drinks, but you can also get testosterone shots and
totally, and look good while doing it.
That's right.
I love it. I love it. Jacob, what's next for you? Where you have a podcast? Where can people find you? Where can they follow you? We know we have Get Refreshed One on IG, but where can they find you?
Oh man, just follow us there. If you follow us there, that'll be the rabbit's hole. There's so many things.
I was
that
about
are going
to say that, the rabbit's hole.
I know, man. There's so many things that are going on within our industry. We're becoming a disruption to the entire industry. My goal was to set out and be the Paul Mitchell of injectables, and it's really happening. It's about to pop off. We're about to destigmatize the use of fillers and neurotoxin, and it's because of everything that I just said in your podcast. I'm keeping it real, 100%. It's about just being true, in a society where this cancel culture society that we live in. Hey, people experience what you're experiencing, and that's okay. You can talk about it.
Yeah.
I love that. And we have some questions here. We have Andre says, did we discuss intimacy issues that men can't share? I think we touched on a few things.
Yeah.
And we talked about just having that partner, Jacob. You mentioned that, like having a partner that you can share with. Men, we may not share it like women have. I'm talking to my girlfriends or my girlfriend. Like we don't use the term boyfriends. We got our boys, our bros, but we have to do more to share, is what I got out of it. And the next question is, who do men share our issues with? That's a great question. Friends, mentors. We definitely think therapists work. We're going to talk about mental health in a couple weeks on this platform. So I hope people stick and stay and continue to follow what we're doing. Cindy, for you, what can men do as we wrap up? The best way that they can enhance their sexual health in terms of exactly what Jacob said earlier. Everybody wants to wake up with a great erection. Like, how do we? And we talked about a bunch of things, but from your perspective, what can men do?
For sure, you want to eat better and exercise. That's number one. Number one, make sure you eat better, exercise, sleep, have some type of good sleep regimen, and then if you need to get your hormones checked, have them checked. Cortisol levels, vitamin levels. Get a full panel. You'd be surprised how family physicians sometimes don't do these type of checkups. It's not a part of the routine physical, so ask for it.
Okay, Alex, for you, we'll take this last question. If you haven't seen your primary in a while, should you search for a new one?
Yeah, absolutely. I mean, I think you should be with someone that you feel comfortable with, and you should have someone that you can reach out to when these things start to arise. If you have questions, annual physicals are always kind of recommended. Even if you feel like you're healthy, you'd be surprised what you may catch early in screening and preventative care. So absolutely find someone that you're comfortable with and that you want to see on a regular basis.
Well, ladies, gentlemen, I really appreciate you sharing your time tonight. So many great questions for everyone who tuned in on YouTube, Facebook, and LinkedIn. Thank you so much for your questions, for your interaction. I hope you all learned something, took something away. And if you didn't, please, you could email me. You can follow us on Instagram at JuneArcher, JuneArcher, or go to IamJuneArcher.com. And I could get these questions out to Alex, Cindy, and Jacob. And please start having these conversations. Don't be shy. Find those friends that you can speak to, that you guys are encouraging each other to get yearly checkups, to go get a colonoscopy, to check your prostate, to talk about all these things that at the end of the day could save your life and save your relationships, marriages, or whatever you have with your spouses. It's important. We want everyone to have a healthy life, a healthy sex life, but a great sexual encounter with the one that you love. It's super important. With that said, thank you guys. I really appreciate it.
Thank you for having us.
And it was a pleasure. This was awesome. I think people needed this.
Yeah.
This was great.
I look forward to it. So this was amazing. Ladies and gentlemen, thank you so much. Jacob, you had something else?
No, I feel honored. I feel honored that I feel like, man, it's so amazing that men's health is being carried by females. And I think that just shows like, hey guys, it's okay to speak up. And sometimes it may be more comforting speaking to a female.
You'll be surprised.
Be surprised. Absolutely.
It's
We're
so
here
much
for
more
it.
accepting. I love it. Yeah.
So Cindy, I think I'm going to take another swig and I'm going to have a conversation with your girl.
All right.
Jacob, you gave me a lot of tips, Jacob. So
Jacob, you're awesome.
I'll let you know if they work or not. Wish me luck. Thank you all for tuning in. We appreciate you. This is Let's Talk Men's Health. Next month, chime in. Let us know. Do we talk about women's health? Do we talk about mental health? We want to hear from you. So thank you so much, everybody. Have a great night. And cheers to you for our healthcare workers and providers. Thank you so much for taking care of us. And we wish you and your families a safe journey as we try to get out of this COVID situation. And thank y'all so much for tuning in. This is June Archer. Peace.
Stay fresh.
Bye. Good night.